Okay, hi everyone. Thanks so much for joining us tonight. We are talking about advocacy with NPKUA, and we have some panelists here. I'll let them introduce themselves in a moment. I wanted to first take a moment to thank our education sponsors. We couldn't bring all of our educational content to you without our supporters, so we're really grateful. This recording, a recording of this webinar tonight will be on our YouTube shortly, and that's where you can find all previous recordings and future webinars, from our program this year and last year. So I will get started with introductions. If you don't know me, my name is Sarah Gallagher. I do have a daughter with PKU. It's on my community connection, and I'm the director of community engagement at NPKUA. In addition to our advocacy committee, which we will be focusing on tonight, I also manage our other community support programs that we have at NPKUA. We'll also be touching on some of those, but we have a mentor program, and we mail out support kits for different life stages. And we have three great panelists here tonight. We have our co-chairs of our volunteer advocacy committee, and I'll turn it over to Matt to introduce himself first.
Hello, good evening. My name is Matt Munger. I am an adult with PKU from Tulsa, Oklahoma, and been pretty active in advocacy for PKU since about 2019. New to the committee here, so still learning the ropes here. But live in Oklahoma. Started a kind of a group in Oklahoma just to connect with others. What was funny, a funny story is I first NPKUA conference I went to in Washington State, I met somebody from my clinic for the first time. So I live an hour away from someone and met them 1,500 miles away for the very first time. So we came home to Oklahoma and started connecting with others with PKU. And that's one of the things that got me started in just connecting others and being active in the community and advocacy in general. So, well, happy to be here. Thanks for inviting me, Sarah.
Yeah, great. And Matt said he's new to the committee, but I would just say he's new in the co-chair role, but he's been an active participant in our advocacy committee for a while. So thank you, Matt, for stepping up and helping to lead one of our subcommittees, which we'll talk about in a bit as well. All right, Meredith, if you want to introduce yourself.
Yes, of course. Hello, everybody. I am Meredith Kaza. I am 25 years old. I have PKU, and I'm in the Dallas area. I am very involved with the PKU community. I've been to almost every conference since I was 10 years old when they first started. So I love being a part of it all. And I feel excited. I think something fun to share about the NPKUA conferences is I've been in every part of it, from the kids zone to the adult dinners. I have been in every phase of the conference, and it's just something that's so fun and rewarding to connect with people, and I enjoy it. And now we're here with sharing advocacy. So yeah.
Great. Thank you. Okay, Clarissa, you can introduce yourself.
Yeah. Hi, guys. I am a PKU parent. My son is just turned 3, actually yesterday. So he is my connection to the community. We are in northern Indiana. And I got into advocacy really just to educate myself, to just be able to prepare like for what his lifespan will look like with PKU, but have really enjoyed getting involved with parts of advocacy that I didn't know existed until I got onto the committee and then really kind of learned a whole lot. So it's a lot of fun and definitely worth the time and the effort. It makes a difference.
Great. Thank you. Okay, so tonight there's just, three things that we're hoping to cover. We just wanted to help everyone understand a little bit more about NPKUA advocacy efforts, the way that we get involved in advocacy, the way that we're, hoping to support the community through advocacy. And there's different ways to do that. So we're going to explore a few different advocacy pathways, ways to be an advocate. And hopefully, really, most importantly, help to share information about how you can get involved if you're interested in advocating for the PKU community. So just a little bit about advocacy. We really, in our advocacy committee and as an organization, take a broad view of what advocacy is. So there's many different ways to be an advocate. It doesn't mean necessarily just, fighting on Capitol Hill or being out, and really present on social media. There's different ways to be a supportive advocate. And these are three different ways that we're going to talk about tonight: awareness building, legislative advocacy, and personal / peer advocacy. So the first one's awareness building. Matt's going to talk about this a little bit, and I will also support. Go ahead.
Yeah, one of the ways that's great to be an advocate is just building awareness of PKU in general. It's a great form of advocacy. Growing up, I always made a joke that the only people that knew what PKU was a nurse or a doctor. It's the only people that ever heard the term PKU. And so I have many friends I went to school with and never even heard what PKU was. So just building awareness of what it is first and foremost a great way to advocate. Obviously, because we live with it, we understand it, but those around us don't. And so, rare conditions are often misunderstood or invisible. So, making awareness of what our condition is like, sharing real stories just helps with reduce stigma, isolation, and misinformation that might be out there. I grew up not knowing a lot of people with PKU, got together in 2019 with 8 adults with PKU, and that was just an amazing experience and learned a lot at that point. Learning that there's other people out there like me, which was a great experience. And then I've been on fire to kind of build awareness of what PKU is for others that don't know about it since then. So obviously, those around us might know, but legislators obviously don't. So that's kind of the next step in building awareness and reaching out there. And I'll let Sarah kind of tag on to that a little bit too.
Yeah, I think the great thing about, just the act of building awareness in the area of rare disease and specifically PKU is it's first of all easy, something that everyone can do. You don't need specialized knowledge. You are an expert in your lived experience and you can speak to that. But it also is important for every other kind of type of advocacy that we'll talk about tonight, and that, the reasons that advocacy is important. Awareness is such a key part of that. So we'll talk about legislative advocacy, but under awareness, building awareness really does inform the work we do under legislative advocacy, because it's shown that legislators are far more likely to act on issues that they understand. They understand how it affects real people in their communities. And so things like storytelling, awareness days, media outreach that you're doing just on an ongoing basis, it creates general awareness in communities, and people who are decision makers will see that and then have a better understanding for lived experience. Also supports, the same thing around insurance and access. People who are making decisions about access and insurance are going to be more likely to make the right decisions if they understand lived experience and how those decisions that they're making are going to affect real people's lives. And it just strengthens our community and mobilizes others to share their story. And it just kind of feeds upon, itself. When people see that other people are sharing their story and then they can resonate with their experience, they feel empowered to also speak up and advocate for themselves and their community. And it also fuels, research and innovation. Same thing. People need to understand, people who have the ability to put time, effort, money into research and innovation that will serve their community are going to be more likely to do that if they see a mobilized community around an issue, and they also understand lived experience. So telling stories, your personal stories, and sharing stories in many different ways. Again, it doesn't mean that you have to be on a webinar like the individuals who joined tonight, or are really speaking in front of large groups of people. Telling your story in little ways can have a big impact. Okay, another area we're going to talk about is just personal peer advocacy. This is another area that we specifically focus on in our advocacy committee. Meredith is the co-chair of our Adults with PKU subcommittee, and if she wants to speak on this, and we can tag team this as well, but I know she was going to share a few things here.
Yeah, for sure. Thanks for letting me share. So, I was going to say for the peer advocacy and personal advocacy, whether that's just sharing what PKU is, like Matt Munger explained in your day to day life, or sharing it more with larger crowds, it's definitely however you're comfortable or confident in sharing, and depending on where you are. But just being able to have that comfortability and the confidence, like it says here on this screen, to be able to share your experiences and your stories. Because at the end of the day, the more people who know about PKU, the more people we're going to have help us find a cure. And that's just a quick way of thinking about it. That doesn't mean you have to tell everybody, but being an advocate for yourself is going to help you and everyone else in this community as well, without even realizing it. So
Yeah.
being able, yes. Sorry, were you going to say something, Sarah?
No, yeah, I was just going to say that this, just thinking that this is probably one of the areas that, like it or not, or whether people have chosen to, they probably are realizing, and listening to this, realizing they are already
Yeah.
participating in advocacy
Yeah.
because, people with rare diseases, people, rare conditions, caregivers, parents of individuals with rare conditions really often they're forced to educate even their own caregivers about their experience, their condition sometimes. So, I would be willing to bet that most people in our community know how advocating for themselves with insurance, how that goes, and they've had that experience. So that is, a form of advocacy, and we NPKUA, our advocacy committee, and our Adults with PKU subcommittee focus on ways that we can help people support themselves and support each other through personal and peer advocacy. Another form of personal peer advocacy is just peer support and mentorship. We do have a mentor program that is open to mentees ages 14 and older. That's one way that we try to support peer advocacy. All of our mentors are peers that are either adults with PKU or parents of children with PKU. Who can connect one-on-one to support community members. And it's the goal of that program, and just in general, personal and peer advocacy is really important to build individuals' confidence and their own agency to make their own decisions and advocate for themselves, like Meredith was saying. Great. Okay, and the last bit, which we do, focus a lot on, we'll be focusing a little bit more on this evening in the webinar, is legislative advocacy. Might be one area that when you hear advocacy, you might think of legislative advocacy, really pushing for changes in laws and support that's out there to support our community. Clarissa is our co-chair of our government and insurance subcommittee, which we'll go over as well. But that one main focus of that committee is legislative advocacy. So I don't know if you wanted to share anything here, Clarissa.
Yeah. I mean, like this is actually one that I knew very little about before having a son with PKU, and didn't realize how much, even just like a conversation with the right person or repetitive conversations that aren't huge responsibilities or not talking in front of a lot of people, just like repetitive conversations with people in our government that can really make changes with laws or policies, and just really trying to bridge gaps and make sure that our kids or our adults living with PKU have continued affordable access across the lifespan of PKU, and trying to address those gaps that currently exist in coverage, where there isn't security for people aging with PKU, or depending on the state that they're in, or just a lot of different loopholes, and trying to battle those and get everyone under the same, secure access to care, no matter the age or state.
Yeah. So you can see, some of the ways on the screen that legislative advocacy can really have a really big impact for community. It's really just about working to change laws and public policies. We participate in legislative advocacy. So like Clarissa said, people living with PKU can have consistent, affordable access to care and treatment that they need across their lifespan. And we have to advocate because people who are making the laws, they don't necessarily know how they are going to impact our community, because it is a rare community, and we have to be building awareness and advocate for those types of changes to have a positive impact on the community and improve the lives of people living with PKU. So on our about a little bit about our advocacy committee, we have a volunteer-powered advocacy committee at NPKUA. So I'm a staff member that manages the committee, but it's really run by volunteers. So we're so grateful to have dedicated group of individuals with really a diverse set of life experiences, interests, and skills. And so our committee includes people with PKU, parents and caregivers of people with PKU, and also medical professionals who are passionate about advocating for the community and sit on our committee. The current structure of the advocacy committee, you've met our three co-chairs here tonight. It really started to take shape about 3 years ago. There was an advocacy committee, a larger just group of advocacy committee. There was not subcommittees at that time, and a survey was disseminated, kind of just asking everybody who's on the committee what they are most passionate about, what their skills are. Ask them to rank their interests on a variety of advocacy-related topics that were mission aligned for NPKUA. And from those survey results, these three subcommittees were formed. I mean, it was really just, they were formed with a goal of bringing focus to three areas that were really the highest of interest to our committee members, to make sure, that we're using everyone's time wisely, that people are being, able to really dedicate their time and focus to things that both they're interested in, that are mission aligned, and that we thought would be impactful. So our three co-leads who you've met tonight help to manage the overall advocacy committee. And then they hold subcommittee meetings on their own and report back to the larger committee. So we meet every other month as a full advocacy committee. And then in the off months, it gives time for the subcommittees to meet if there's a project that they are focusing on. Those meetings focus on specific action items that the larger committee has identified in each area, or just projects that the subcommittee has identified that was of interest to them and something that they wanted to work on to be impactful. And having the subcommittee really supports efforts that require more focused work. There's a smaller group that meets consistently and helps bring the continuity to those projects. And individuals that want to join our advocacy committee, you don't have to be part of a subcommittee. You can be part of multiple subcommittees if you wish, or you can just participate in the broader committee meetings and lend your. You can sit and have a listening ear and learn, but you can also lend your expertise and knowledge in anything that comes up. The subcommittees, like I said, always report out to our larger committee. So not everyone who's in the advocacy committee is part of one of these subcommittees. Everyone kind of contributes to all areas when they come up and we're working on different projects. And we will kind of just talk briefly again about this subcommittee. So we covered these areas of advocacy, but I wanted each co-chair to also share a little bit more about what their subcommittee does, kind of what their goal is, and some of the projects that they've worked on in the past or will be working on in the future. So Matt's up first.
Yeah, I appreciate that. And our subcommittee is basically what it sounds like, awareness and community, right? And so you can see there on the slide some of the bullets of the things that we're doing or talking about, some of which are new, some of which we've done for several couple years now. So the media toolkit, I think, is a great tool that's out there for anybody who wants to get involved. Step-by-step guide on how to tell your story in the media. And so it is available. It's on the NPKU website under the community programs tab. So if anybody's interested, you're able to go look at that. But that's something this committee kind of talked about and kind of put together. Obviously, community is a huge part of being part of the community of Rare Disease Day. Rare Disease Day and PKU Awareness Day and Month is something big from this committee. Growing up with PKU, for those that don't know, I'm in my mid-40s, early to mid-40s, let's just say that. And so growing up with PKU, there was no social media at the time. We live in a time where social media is huge now. And so we are able to connect and create these programs in the community now because of social media, which is great. And so a lot of campaigns and community is built through Rare Disease Day and PKUA, not NPKUA, PKU Awareness Day and Month. And so those are some great opportunities to get involved, whether it's just on social media, whether it's, something we do here in Oklahoma is we will do an event generally on PKU Awareness Day or Rare Disease Day and just get together and hang out. I think this past Rare Disease Day, I should clarify that. We did eat pizza, but it was a pizza that had low protein pizza and low protein cheese, low protein uh, crust as well. So everybody was able to eat, but it was just an opportunity for us to come together as a community. Move Your Feet, another campaign that the NPKUA puts on that helps raise money for the NPKUA's mission to improve lives of individuals and families affected by PKU. Another community event that's great. They build teams of people in a certain area and try and raise the most money. I even got hit up this week by somebody in my area say, "Hey, are we going to do this? Are we going to put together a team?" So we're working on that here in Oklahoma as well. And Missouri. Actually, the person that reached out to me is from Missouri. So we're gonna make sure and get that going as well. So just several opportunities to bring awareness to the community, connect with the community. I'll let Sarah talk a little bit about the proclamation project. That was a little before me, and I wasn't
Yeah,
sure
poor
exactly
Matt.
what that was. So
As Matt shared, he very recently stepped into this role, so we haven't
yeah, so
completely
I'll
filled
turn
in.
that one over to her. But again, just great opportunity. Anybody that wants to get involved, please either join the committee, follow the social media information on how to get involved as well too.
Yeah, great. Yeah, so as Matt was hinting at, he's going to be caught up. He's going to be leading, his subcommittee on a project that we haven't completely caught him up on. But what with the idea is that for PKU Awareness Day in December, the subcommittee on awareness community, and Matt does know about this, but just recently, so that's why he wanted to pass it off. Happy to speak about it. They're going to be putting together a toolkit for community members to have proclamations passed in their town or city. We really want to see how many we can make happen in 2026. So stay tuned. Toolkit coming your way from the Awareness and Community Subcommittee.
Thank you.
Yeah. Great. Okay. And Meredith can talk a little bit about adults with PKU.
Yeah, of course. So I help with the adults with PKU. I mean, like Matt said, it's kind of straightforward with the title, but we're able to connect and with adults with PKU in the community. Obviously, there's all different walks of life with having PKU, but specifically with adults. PKU does have newer treatments, and they were for just adults at one point, like Palynziq, even though now it's for adolescents as well. But adults do have different perspectives with living with PKU. So we have this group to connect and have conversations and brainstorm ideas for the community and for the adults, but also we're able to support each other during that time. So some things that we have been able to come up with is the support kit. So I'm sure Sarah also might want to talk more on this as well, but we have the support kit that is in the very beginning stages. And then we have the PKU lexicon. This is a project that we are in the beginning of, but we have been brainstorming and coming up with ideas as the co-chair. And we are basically going to be coming up with different ways to share how to share PKU and what wording we should be using, whether that's helping us with insurance purposes or that's helping us share words that help people know what PKU is. Because we can sit here and say phenylketonuria, and that might sound intimidating, but then if we reword it and say PKU, that's one quick example. But overall, just being able to support each other, hear each other's stories, and listen to any ideas from anybody, how we can help connect and explore being adults with PKU, because we're all going to be there sometime if you're not already.
Great. Yeah, for the Reconnect kit, this committee was really instrumental in helping us shape a new support kit that will be launching in April. It's a kit that's aimed towards adults with PKU who may feel disconnected from community and or care. So it's includes resources to help people get reconnected. And so this committee, really was helpful in brainstorming important language to include. What not to include, really how we could make this kit as supportive as possible. So we, really relied on our adults with PKU who are living with PKU, and had thoughts to recommend for this kit in the development. And as Meredith said, that kind of goes along with PKU lexicon too, just making sure we as an organization listen to individuals with PKU, people who are living with PKU, their caregivers, and thinking about what language is most inclusive, sensitive, and like Meredith said, makes the most sense to others as we're working to build awareness, and working to come together and support each other as a community. So those are our subcommittees. Like I said, you don't have to join a subcommittee to be involved with advocacy. We have people that are also just part of the larger committee who just come when they can, and all are welcome. Okay, and here is our last subcommittee. Sorry, I almost forgot you, Clarissa. Last but not least, government insurance. Clarissa can speak on this one.
Yeah, so we obviously are working on, the policy change or trying to make progress on some things in legislation, and paying attention to what's happening in the different states and different state levels, federal level, different laws, working with other associations to just kind of try and push everything forward. The two big things that our committee has been working on lately is just coming up with content ideas to educate our community on how they can actually get involved with legislative advocacy, like who to call, what to say, what are important things to talk about, and just like how to tell your story, but make something potentially big feel smaller. And then also just tools on how to navigate insurance denials, and just how to, the legality of our disorder that we work with and how to do those things. So just trying to come up with content that supports our community and really educates and kind of debunks some myth around legislative advocacy. The really big thing that we've been focusing on, and it sounds like for a while, because it was before my time as well, with PKU community, but the Medical Foods and Formula Access Act is a piece of legislation that we are trying to get through, to help kind of standardize care for medical foods and formula with state-funded insurance. So it's kind of a stepping stone. Hopefully we can get private insurance kind of on the same hook, but really just trying to get our foot in the door with this problem and bridge the gap here. So this has been something that we're trying to get more community members to advocate in their home states with their legislators, and just have conversations to try and educate. That way, when hopefully it comes to vote, they know what it is and what it means and how it helps their constituents. So that's definitely been a big project that we've been assisting with.
Yeah, this subcommittee, we're, like I said, we're lucky to have a lot of really seasoned advocates on our advocacy committee, all volunteer based. But this subcommittee has advocates who've been working on this issue for a really long time, in addition to Clarissa, who's been a great leader, newer to the community and to this issue, but great leader of that subcommittee. And they've really been instrumental in helping us as an organization as we develop a plan for, communicating with the community about this issue, other issues, really helping kind of weed through many years of efforts on this area, and help to develop a current up-to-date communication plan. We'll talk about some of that, kind of the work that we've been doing on that, but this subcommittee really helps with those conversations, developing some of the social media campaigns that you might have seen, things like that, and coming up with ways and input of how best to communicate what can be very complicated topics in an understandable way to all community members. So thank you, Clarissa. Okay, I'm just going to speak a little bit more about legislative advocacy and some of the other areas that NPKUA does participate in legislative advocacy. We in addition to Medical Foods and Formula Access Act, previously known as Medical Nutrition Equity Act, there are a lot of other specific bills and advocacy efforts out there that have a direct impact on our community. So we participate in advocacy by showing support for specific bills and advocacy actions. I'll talk a little bit more about that in a bit. We have direct meeting with legislators, either about medical food access, other issues. We have been scheduling meetings. We invite constituents to those meetings. So that's one of our activities in this area. We might just support by submitting comments when we're asked by leaders of a specific effort, submitting comments on proposed rules and bills. That's something that we're often doing behind the scenes. We might not always be sharing some of those things out on social media, but there's always kind of these support behind the scenes that's happening with different things that are in the works in terms of rare disease advocacy, legislative rules and bills that are people are working on. And then sharing, we work hard to share patient stories. We of course share them out to our own community, but we also gather stories, lived experience to share with legislators. So we talked about at the beginning that that's really important when we're trying to advocate and make these rule changes. People really need to see how that impacts individuals living with PKU. So that's how we try to be a participant in different legislative advocacy efforts. We have recently developed a policy grid. So this is just a visual tool. We needed a way to really organize our priorities. Like I said, there's a lot of different things in the legislative advocacy space that are constantly happening, sometimes fast moving. And we wanted to make sure that we're focusing our efforts on the areas that really are most impactful to our community. So it's a visual tool that helps us organize and categorize how we'll use our capacity for different rare disease policy initiatives. So you can see we've organized into 3 different categories. The first one is lead. We'll put issues in this area. It's not necessarily issues that we're the only leader on, or maybe even the main leader, but for us, things that we categorize under lead, it just means that we're choosing to dedicate our time and our capacity to take initiative in this area, set some of our own strategy, and just really work actively to drive the advocacy in this category forward. And then in the area of support, here you'll find issues where we wish to support other leaders on. So we're going to lend our voice in support, maybe through sign-on letters. Like I mentioned, that's one of the activities that we participate in. Other asks, we might hear from another organization who's really leading on an issue. They will say, can you find constituents in this state who might have this experience, who can share their story? So we really try to respond and support because in this area, we really want to work to support to move shared policy goals forward that impact our community. And then the last category, monitor, is just where we track issues that developments of things that come on our radar that might not at this time be directly relevant to our community, but might have or may not have been introduced, but is something that someone's going to bring forth. And we really just want to monitor it and make sure that we're there to lend support once it does become a relevant issue for the PKU community. So in terms of making decisions of how we place our priorities and what category we might place a different issue in, we really look to leaders. There's a few very large national rare disease organizations who are very heavily involved in legislative advocacy. So instead of reinventing the wheel, we definitely look to our leaders and try to stay connected with those different organizations. So we know what's out there, what they're supporting, and so we can look at those things that they're supporting and decide which ones are also relevant to our specific community. We utilize our community advocates. Like we said, we have great volunteers on our advocacy committee. So they, just this month when we had an advocacy committee meeting, we shared our policy grid and people brought great ideas for new things to add to our policy grid. And we're really just, again, considering how something will impact our community. We have, of course, limited capacity. There's not unlimited capacity. So we want to make sure we're spending our time and efforts on things that are most impactful when we're making the decisions. So our current, always open draft changing policy grid, but the things that we are focusing on, I won't go over everything on this slide, but just to touch upon the 2 things that we've identified as important to be leaders in. The first one is newborn screening. If you were following us on social media last year, you may have seen that there were some threats to current newborn screening program and in the US, and we want really recognize that as an issue that NPKUA wants to be a leader on supporting newborn screening. PKU is the first condition to be screened by newborn screening. We really feel like, of course, for our community, it's important to maintain robust newborn screening, but also to be a support for other conditions who are still fighting to either be on the newborn screening panel or protect their access to newborn screening. So that's one area that we've chosen to lead on. So again, when we talk about leading, taking initiative, so this was something that we scheduled Hill meetings for, wrote position papers on, and took an initiative to support the area of newborn screening. And then the Medical Foods and Formulas Access Act, as Clarissa mentioned, it's been a top priority for our community for many years. And so we continue to, have a desire to be a leader in that effort. And then if people have any questions about any of the other pieces of our policy grid that you see on the screen, again, I won't go into all of them, but happy to chat with anyone or to share additional resources if you are into legislative advocacy, want to learn more about some of the current issues out there. You can always send me an email, sarah@npkua.org, and happy to share. We have a whole summary of all of these that we reference. But these are things that we have our eye on, and then we've already done the thinking. When we get a kind of last minute request, hey, can you sign on to this letter by tomorrow, which is often how it happens. If we can look to our policy grid and say, and look to our summaries and say, okay, we've already considered this. We know it impacts our community. We've already identified it as an area that we want to support. So it's an easier way to answer that question and act quickly to support important legislation. Okay. I'm just realizing I'm seeing some things in the chat. Oh, thank you. Clarissa's also answering. Good. Yeah, and I forgot to mention that it looks like we are having just a glitch where Q&A is not at least showing up on my end. So if you guys have questions, as some of you have done, go ahead and stick them in the chat and we'll try to pay attention, and we will have time for questions at the end. Okay, so how to get involved? Again, you can join our committee. It's open to anyone, everyone. You don't have to be consider yourself an expert in any type of advocacy. Come listen and learn. Clarissa shared that she was new to the community, new to advocacy, and joined our committee. And then she stepped up to lead one of our subcommittees. And she's really kind of, she dove right in to learn about that type of advocacy and to really help us as a committee be organized and make sure that we're doing impactful work. So it's open to everyone who wants to advocate for the PKU community. And quick email to my email is how you get on the list. And again, we meet every other month. You'll be invited each time we have a meeting, and people will come when they can. As Matt mentioned, we do have some resources digitally on our website. For example, the media toolkit, he shared about that. And that's just kind of a step-by-step guide of how to tell your story with the media. So that kind of awareness building piece of advocacy, trying to make that easy for individuals. A lot of our community members have done this. I'm sure you guys have seen some articles out there, and it's really helpful to get wider spread awareness in the general community. We also have an ambassador program. We call it our ambassador program because we are often given requests for by either industry partners, researchers who want to learn more about the experience of living with PKU or caring for someone living with PKU. They will ask NPKUA to connect to individuals. And so we have people who have identified themselves as someone who likes to participate by telling their story. It might be, speaking at an event. It might be reviewing a clinical trial protocol and giving feedback, all different types of asks. But that's a way for us to know that you're out there and that you like those types of activities and want to share your story. So if you'd like to get on our ambassador list, you can also email me. And then, obviously participate in our awareness campaigns. Matt talked about some of them. If you're following us on socials, keep an eye out for those. We try to work hard to make awareness building easy for our community members to share with their broader community members and their connections. So we create posts that are intended to educate people who don't know much about PKU, and so then as an easy share for you to share with your networks on social media. So keep an eye out for those, especially around Rare Disease Week. PKU Awareness Month, PKU Awareness Day. That's when you'll see a big push for those. Matt mentioned Move Your Feet. Registration is now open. It's on our website. And if you have any questions, please reach out at any time. And those legislative action alerts, we've been also trying to share those widely. Sometimes they're in our newsletters, sometimes they're in social media. We try to make it really easy, again, for everyone to participate by taking action. I will show just one example of something that we've shared. So again, we're doing a push for the Medical Foods and Formulas Access Act. So you might see something like this, where we really try to break down the steps, give you a script. It's an easy phone call. So that's another way to stay involved. Just keep an eye out for those, and follow the script, follow the action ask when you see them, and comment that you did, because we love to see that as well. Okay. Also wanted to, I mentioned briefly, there's national organizations that you can get involved with if you're interested in kind of getting more involved in advocacy. And the National Organization for Rare Diseases, national organization supporting all those living with rare disease, and they are heavily involved in advocacy. They do have an advocacy training that we have access to as one of their member organizations. If anyone wants to kind of do a legislative advocacy 101, really it's designed for both new advocates and more seasoned advocates. Please reach out to me and I can sign you up and give you access to that course. I know some of our co-chairs have done that course. I've offered it to all of our advocacy members, and really it's open to any of our community members if they want to take part in that training. And then I just put up their website where you can see some of the other action items that you can take part in if you want to be involved in legislative advocacy and policy. Every Life Foundation for Rare Diseases, they also do a lot of work around educating rare disease community about advocacy and then direct advocacy work. They hold monthly webinars that you can register for. I put the website where they'll list those, and you can also watch old recordings. So just a really treasure trove of information that you can learn from Every Life. And then they also will put out their own action alerts. Again, that's how we get a lot of our information about what's happening in rare disease legislation and how we can support. Okay, so that's the end of our main content. I'm going to try to quickly look in the chat here. I know that there were a few things in there. Looks like Clarissa, you handled the questions. If anyone has another question, you can throw it in to the chat. While we're seeing if anything comes up and while I'm reviewing that, if Clarissa doesn't mind, I'm gonna maybe put her on the spot. Because like she shared, she was new to both learning about legislative advocacy in our PKU community, and she jumped in. So I wanted you to share, Clarissa, if you can share like some of the ways that were helpful to, for you to feel more confident in participating in advocacy. And then if you want to share your recent experience at Rare Disease Week too, people might be interested in hearing that.
Yeah, sure. I love being put on the spot. Just kidding. I think for me, legislative advocacy in general, like I just was really naive, or like undereducated on what it actually is. And it felt really far-fetched or far away for me. So like it didn't feel like something that I do from home or something that I can do in my state. Felt like something that someone who was educated in it, went to school with it, had experience in it, that's what they do. So I was very wrong. It's definitely something that doesn't take a huge time commitment, and really just telling your story is a huge part of all of it. So I think that was something that, jumping in, it felt scary, but it really isn't. And it really is just talking like, hey, I'm a mom of a child who I'm concerned that when they turn 26 in our state won't have access to formula, based on whether his insurance will cover it or not, and what that means for him if he doesn't have access to that formula. And so just really being able to share like as a concern for realistically for somebody that you love, or somebody, if it's yourself, whether that's you're dealing with PKU yourself or a parent working with a child. And that's the most powerful thing. And also like being able to see how much those little conversations can ripple into big changes for our community, that helps solidify and secure people with PKU. So I mean, I think that just paying attention to those little tidbits on the content really helps with social media because they do put out the NPKUA puts out like lots of easy ways to get involved. Like you saw the example, it's literally a script that you can read if you're not comfortable otherwise, and you can ask other people in your family to do the same thing, just to call and talk to your state legislators to do those things. And I think that was something that I really didn't understand how those small conversations add up. So that was good. And then I did get the wonderful opportunity to go to Rare Disease Week on Capitol Hill with Every Life Foundation. And that was really cool, just to see other people with rare diseases that aren't PKU, and realizing that 1 in 10 people have a rare disease. So it's not really rare when you put us all together. But just there's so many different ways that rare happens, and seeing other people advocate and just learning and then being able to talk to people from my state, legislators, so our senators and a couple of different Congress members to try and move this, make the ask. So that was a really cool opportunity and very helpful and educating, and just kind of a different world than what what I've ever been in. So, but that was really fun, and I definitely recommend it for anyone who is able to go.
Yeah. And so, yeah, again, that's through Every Life. If you need any information about that, you can reach out. Also, it is free to attend. You have to get yourself to DC if you're not there locally, but otherwise free to attend. And yeah, you kind of learn really quickly how to tell your story because you're doing it over and over and over again all in one
Over and over, yeah,
day.
6 times in one day.
Yeah. So it's great. And Stephen, I just see your questions. I know you said, I answered, but I can speak a little bit more about kind of how we collaborate with other organizations. I spoke tonight mostly about, some of the national organizations and legislation at the federal level, but we also do collaborate with state-based organizations, and we're always interested in knowing what efforts are going on in individual states, and we always lend support to pieces of legislation and efforts in states. For an example, last year there was a few different states that saw their newborn screening kind of coming under pressure, or were being threatened. So those local advocates contacted us, let us know what was going on, and we always lend our voice for support for that as well. I attend some state-based coalitions that are led by other rare disease organizations outside of the metabolic area. But there are, like Clarissa said, we're not rare when we come together, and there are issues that affect that we have in common that affect rare diseases in general. And so that's another way that we collaborate with state-based organizations, both learning and supporting efforts for, at the state level. And then, yeah, I know you had also a question, medical food companies also, that's again, part of the leaders that we look towards when we're in developing our grid and what we're going to focus on. Those are some of the areas we've had people from medical food companies, industry come and speak to our advocacy committee because a lot of them do a lot of their own advocacy work. So both educating, education, we look towards them to help educate us as we look to really expand our efforts as an advocacy organization and committee. So we are also in constant contact with those types of organizations as well. Okay, I don't see any more questions in there. Definitely want to thank our panelists. I don't know if anyone has any parting words, no pressure to, but thanks so much for joining tonight and sharing. Like I said, we just as an organization can't do anything we do without our volunteers. So the individuals on this call, the individuals on our advocacy committee, and all of you who follow our social media and share our posts and all of that, we really rely on the commitment of our volunteers, and just really grateful to have their participation. And just help so much to also build community and support each other, like Meredith was saying. I love that the Adults with PKU subcommittee feels like there's support for each other. That's just a beautiful thing. They have support for each other, and then a support for the broader community. And it's always a joy to get together with our volunteer advocacy members. And we'd love for you all to join us. If you have any questions at all, my email's on the screen. Please reach out anytime. And if you want to connect with any of our panelists, also please reach out to me, and I'm sure they'd be happy to answer your questions as well. So we're ending just a bit early, but thanks so much for joining tonight. Again, recording will be available shortly on our YouTube, which you can find on our website or just by Googling NPKUA and YouTube. And thanks so much.